Welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Okay, so today we're going to start talking about the 3 most common causes of back pain.
Okay, well, I heard that a third of all doctor visits, people are seeking help for their back pain.
That's right, a third. That's a lot. And we're going to be talking about the first common cause, which is lumbar degeneration and stenosis. All right, guys, so in this series we are talking about the 3 most common causes of back pain. And today specifically we're talking about lumbar stenosis or degeneration. And that just happens with age. All right, so as we age, the bones of our spine, the vertebra and the disc both degenerate. And as they degenerate, they cause the spaces for the nerves to come out to get smaller, and that's called stenosis. So we're going to talk about the 3 most common exercises you can start doing today to help you maintain or manage your low back pain from stenosis or degeneration. And today we have Skylar. She's a kinesiology student from Louisiana Tech, and she's working with us here, and she's going to be our demonstrator today. So you can go ahead and lay down. All right, so the first exercise for lumbar stenosis is to pull both knees up toward your chest. You want to put your hands behind your knees, not on top of your knees, because that puts undue stress on your knees. You're going to hold this stretch for 30 seconds and do it at least 3 times. Now, if you're unable to do this with both knees, do one knee at a time. And you can also actually even just do this in a seated position, just by leaning over toward the ground to help open up that lower spine. All right? Then secondly is a lower trunk rotation. So feet and knees together, and you're going to rotate your knees side to side as far as you can without significantly increasing any pain. This is really good to do before you ever get out of bed. Anytime you have pain, lay down and try to go through these exercises. You can start doing it, 10 times. You're not holding it, you're just going as far as you can, each side. Keep your shoulders flat, and remember, don't cause pain. And then another really good stretch for lumbar stenosis is the piriformis stretch. That's the muscle that goes kind of right through your buttocks, and it's the one that can cause a tension on the sciatic nerve, and that'll cause pain down your leg. So again, cross one leg over, push down, hold for 30 seconds, and then pull up and across, hold that for 30 seconds. Do each of these at least 3 times, holding for 30 seconds each. All right, so that's the 3 most common stretches that you can do for lumbar degeneration and or stenosis. And next we're going to go over 3 most common strengthening exercises. Now, it's very important that we maintain flexibility because God gave us a skeleton that has to move in order for us to function. Now, that skeleton doesn't work alone, it works with the muscles that help support it. Now, as our backs degenerate, our muscles degenerate too, so it's very important that you maintain good muscle strength to help support those joints to help decrease the pain. So first we're going to do a pelvic tilt. This is your core, and it's important that you learn how to engage it and how to control it. So really think about moving your belly button down toward the mat or bed and up toward the ceiling, okay? That's going to move your pelvis back and forth. And once you learn how to move it, then you're going to use those same muscles to stabilize it. All right, so you're going to hold those muscles tight. Not only while you're doing these exercises, but while you're moving, like when you go from sit to stand, when you're walking, when you're standing in one place, you start to hurt. Engage these core muscles, and that'll help decrease pain. All right, so with your core engaged, you're going to do single knee to chest, up and down. You're going to do about 10 times with that, and then you can do a straight leg raise. Again, engaging the core, raising the leg up and down like that, okay? So these are very basic beginning core strengthening exercises, very important to help you manage lumbar stenosis and degeneration. Come back next time, we'll talk about another cause of back pain. Thank you.